Hi, my name is Alyssa and I'm with Knob Noster Physical Therapy. I got my workout gear on because we're working out today. Today I'm going to show you an exercise that we utilize in the clinic to begin working on landing mechanics and jumping mechanics for our patients who maybe either have an injury to the lower extremities or have had surgery. So what we'll do today is what is called a depth drop. So what we'll need is a box. We usually tend to start our patients off at a smaller height to get them comfortable with that landing mechanics, get them comfortable with the exercise that we're demonstrating today, and then we move up to higher levels. So landing mechanics are very important as far as our plyometric activities. We want to make sure that a patient can land safely and easily on both legs. And you can also influence this one by make it a little bit harder by challenging a single leg landing. What we're looking at when we assess this activity is our patients landing equally? Are they absorbing the force properly as we're moving through the activity? One thing that I tend to see a lot are very stiff leg landings, which create a lot of force production up through the knees, into the hips, and that low back. Creates a lot of jarring force and is a little bit harder on our tissues than a nice soft using our muscles to absorb the force type of landing. Today I'm going to demonstrate both a double leg depth drop as well as also a single leg depth drop. So I'm going to start on top of the box. We're going to face out away. And what we'll do, I oftentimes don't have people jump off of the box at the beginning. I'll often have them just take a step. And what we are going to do is step off of the box and try to land nice and equally on both legs. So it'll look just like this. So here we're looking at that nice equal landing. Did we absorb the force with our knees rather than jarring them up through our whole body? A single leg in a much more advanced version of this, which we would oftentimes introduce later in a treatment session before we do any single leg hopping, any single leg bounding of any sort, is to do a single leg depth drop. So that looks a little bit different and also requires a lot more stability of the knee and hip. We want to make sure that patients are landing squarely. They're not falling out of their land. And we oftentimes stay a little bit lower with this one until they get that nice control, as those higher heights are much harder to work with and to land safely on. So a single leg depth drop would look just like this. Again, making sure we're not landing stiff-legged, making sure we're absorbing that force, keeping that knee nice and straight. We don't want to have any wobbling of the knee in or out or any twisting of the body over the top. And a lot of times we use this for our athletes who are looking to return to sport, looking to return to any jumping activities, volleyball, basketball, long jump, football, anything that requires a lot of force production and a lot of force absorption. This is a great activity to start introducing them to that jumping activity before we go full force into our normal clinic activities with more agility training. As always, if you need anything, please feel free to reach out to the clinic or check us out at knobpt.com.